Welcome to scanO Cafe, the podcast where we explore the fascinating world of dentistry and oral healthcare, uncovering the stories of professionals. Today, we have the privilege of speaking with two incredible guests, Dr. Yogesh Chandarana and Dr. Pranav Chandarana, the visionary minds behind Dr. Chandarana Dental Museum, Asia's first and only private museum dedicated to dentistry. Dr. Yogesh Chandarana, the founder of museum, has not only pioneered this one-of-a-kind establishment, but also has made history with two Guinness World Records: the largest collection of toothbrushes and the largest display of toothbrushes. His passion for dental history and education has turned a simple idea into a revolutionary space that bridges the past, present, and the future of oral healthcare. Joining him is Dr. Pranav Chandarana, an accomplished orthodontist who has expanded the museum's vision with modern innovations like AR experiences, animatronics, and AI driven dental health assessment. Together, they are transforming the way people engage with oral health education. In today's episode, we'll take a deep dive into their inspiring journey, the stories behind their extraordinary collection, and how technology is shaping the future of dental awareness. Stay tuned for an enlightening conversation. Hello, once again to scanO Cafe. I am your host, Dr. Vidhi, and today we don't have just one but two extravagant guests with us. Welcome to scanO Cafe, Doctor.
Thank you, Dr. Vidhi.
Dr. Yogesh and Dr. Pranav Chandarana have been a pioneer in all the activities that they do, but we will dive deep into the new things that they have got into Asia. Doctor, can you share your journey from SSG Hospital to founding the Asia's first private dental museum? How did that thought ever come to you?
So basically, I was a collector of postal stamps on dentistry when I was a dental student in a college. So I passed in 1975, and then as you very rightly had put it, I joined SSG Hospital. At that time, when I was in college, it was very difficult even to collect postal stamps on dentistry because it was not easily accessible. But slowly, with my involvement in philatelic societies of Baroda, where I got a very good doctor, respected doctor friend of mine, Dr. Ashwin Patel, who was basically a surgeon and a very good collector of postal stamps of various subjects. So I did talk to him, then he helped me, and slowly I started collecting postal stamps on dentistry. Then I got a normal thought that when you collect a postal stamp on dentistry and just if you put it in an exhibit, it is very dry.
Hmm.
So you need to develop a collection in a way that people would be interested to see it, and not only interested to see it, but they will learn something about dentistry. Because at the time when I passed in 1975, there was nothing much about oral health awareness. वो दांत के डॉक्टर है, ये तो डेंटिस्ट है, वो that people not were recognizing dentist at all, and that always used to pinch me in my heart कि वो दांत वाले डॉक्टर को बोलते ये तो दांतिया डॉक्टर है. So there was no respect in the society about dentists. So that made me to go in depth of collections, which I went on exhibiting at district level, at national level, and then later at a international level, and was awarded various medals. So then, when I was working in IDM, which I started from normal Vadodara IDA level, I was more inclined towards public health awareness activity. So I had observed when we used to make a camps, when we used to make any public activity, people used to come, just have a look around, see it, good poster, good, and they go away. So they were never taking much interest to look into the details of the posters and exhibit which we have kept.
Correct.
So that was always there in my mind that people do come, they do want to learn something, but there has to be something where they are being taught about dentistry in various different forms. So slowly, when I went into a practice, then at the age of 50 years, I joined the College of Psychology for learning hypnotherapy and graduated as a first hypnotherapy from a first batch of MS University in the India.
Wow.
So that taught me so many things about people's perceptions. So, we don't just perceive things like that. We perceive things with our vision, with our listening, with our environmental things. So many things are of utmost importance in perception of an individual. So, I thought, why not make something which can make dentistry perceived in a very different form and still more effective? So that made me to think that let me start something for people. Now what happens most of the time as a dentist, we talk about our instruments, we talk about our advancements. So that is all, people like it, appreciate it. But for everything, when they come to us for treatment, they have to pay something from their pocket. So it becomes more of a dentist centered than a patient centered. Patients are at an advantage when we treat them with a modern dentistry, that they get the good or better treatment day by day. But they have to pay for it. So I just thought, what is there something in the hands of a patient which will make them see it in a different way, and they will learn more of a preventive oral health. So the thought came of having a toothbrush, toothpaste, and our tongue cleaners and all that in my mind. So I started after I came into my practice, and before my son Pranav joined me, I started collecting the toothbrushes, various kinds of toothbrushes in the country and slowly then in the world. So having collected the toothbrushes, I was sure it will fascinate patients more because it is something of their own interest.
Correct.
So I thought, let me make people that how should you brush, which kind of toothbrush you should use, what kind of toothpaste you should use. So that will interest them. This is something by which we can take care of our own teeth and we won't have to go to a dentist.
Correct.
So early or except for a checkup. So after I collected and after my son Dr. Pranav joined me, we thought of creating one place which I knew is nowhere in a country as a dental museum, where we can exhibit various kinds of things related to dentistry under one head.
Right.
And
That's how the idea came into the
that's how
origin.
the idea came. That's how the
Wonderful.
idea came.
Nice.
And
And I'm sure, I mean, you have the largest collection of toothbrushes and toothpaste too.
no,
Okay,
not yet.
toothbrushes, correct. What all categories of things do we have? I want to know both from the dentist point of view, the things that dentists use. For example, you just got the oldest dental chair, right? So, can you walk us through all the dentist centric things that we have in the museum and all the patient centric things?
Pranav, would you like to highlight something more on that?
So basically, as you very rightly said, we have the world's largest collection of toothbrushes. We have almost 2,371 varieties of toothbrushes from across the world. And we also have the second Guinness World Record for the largest display of toothbrushes in the world. So toothbrush is the primary thing that we have in our museum. Along with that, something which will be of interest to patients, we have a lot of different types of oral hygiene aids. We have paintings and figurines and statues related to dentistry. We have coins and currencies related to dentistry. People who are freedom fighters in their countries and depicted in their coins and currencies, and they were dentists also. We have a collection of toothpicks. Again, it's a very big history of toothpicks also that we have portrayed in our museum, which is again in the hands of the patients. Tooth powders, toothpastes. I think we have a lot of things related to
Yeah.
this. We have
Roxa
games
brush,
and
water picks.
things which are related to dentistry. We have the world's first dental Uno game, deck of playing cards, snakes and ladders. While playing which you can learn about
Dental health.
We have also developed one oral health express for kids, which guides us through the 5 golden rules to healthy oral health. So the train will stop at the stations which are positive ones. The negative ones will stay out of the station, and it plays a message. We have also tried to incorporate in terms of something interesting to the dentists, old dental instruments, old dental chairs. We are lucky and privileged to have the dental chair of Dr. R. Ahmed, the father of dentistry in India, and which is we are really fortunate to have it, which even the Dr. R. Ahmed Dental College in Kolkata also does not have it. We recently added that to our collection, and that was a donation from Dr. Kishore Gupta and family from Kolkata, who were cherishing it and having it with them. They found our museum fit to be the right place to treasure this additional thing. We have Gujarat's first dental X-ray machine, which came to Vadodara in the year 1952. We have the successor of the thimble drill, which is considered the world's first drill used for cavity preparation. So we have an 1850 successor of the thimble drill also, and different generations of dental drills, different generations of local anesthetic syringes. You must be knowing about Punch magazine, which is the world's first magazine which coined the term comic.
To the world.
Right. So we have comics from the Punch magazine which are more than 100, 150 years.
Oh, wow. Nice.
We also have newspaper advertisements, stationery with dental advertisements. And talking of newspaper advertisements, we have the newspaper advertisement of Dr. John F. Greenwood, who was the dentist to JF Kennedy. So he had put a editorial in a newspaper which is 215 years old, and we have that original newspaper.
Oh, wow. Nice.
We have through our museum tried to recognize people, including Dr. K.D. Jilla, who is an unsung hero of dentistry from Gujarat in Navsari, who wrote books on oral health awareness and literature on oral health awareness as a dental patient from 1920 until 1940s. And Dr. R. Ahmed came across one of his booklets and he invited him to become a dentist.
Oh, is it?
As a dental patient, he wrote oral health awareness booklets. And he was an unsung hero, no one knew it. With efforts of Dad in IDA, he got recognized as pioneer of oral health awareness in our country.
Wow.
And along with Dr. G.V. Sangpalkar, Dr. R. Jillas is also celebrated on 1st of August as National Oral Health Day in our country.
Correct.
So, all in all, we have almost more than 7,000 items related to dentistry
Wow.
from across the world, which Dad has gathered over the last 40 plus 50 years, I would say now.
Right.
And we have housed it to create awareness among the masses.
Correct.
That's our basic.
Yeah. Thanks for walking. 7,000 items is a big, big number. And I think, is it the largest private dental museum? With maximum number of items? Wow.
Now we are actually falling short of a lot of space.
Space, right.
To display. So in our museum, we have tried to,
all the
corners of the museum are full with something or the other.
Right. How big is the museum right now?
So our floor space at this point of time is around 3,500 square feet.
Right.
The museum and the auditorium spread out in 2 floors.
Right.
Probably.
I wish it, let's expand to 7,000, double.
We can definitely try and expand it.
Right. And then put in more such antique pieces which sings the history of dentistry, which talks about the importance of oral health, and which makes dentistry a discipline, not just dentistry in general, but all the disciplines of dentistry, a highlight among common people.
Very right.
I think it has only been the journey of last 1 decade, 10 years, that people are knowing the differences of endodontist and a prostho and an orthodontist.
Very right.
Otherwise, as you rightly said, doctor, Data nu doctor, right? A dentist as a common terminology, nobody knew about all the different kind of surgeries and specialities that we have.
In fact, Dr. Vidhi, we have tried to show to our museum visitors all specialities of dentistry and what is the scope of each specialty also, so that they understand dentistry as a whole better.
Correct.
Right? Because what happens sometimes is when an individual goes to a particular specialist, he understands only his specialty, but a museum visitor at our place understands what
all
is the
the
scope
specialities.
of different specialities
Of
dentistry
dentistry.
also.
Wow.
And we have tried to bring in old stuff from those different specialities. We have tried to bring in some funny cartoon figurines of those specialities, so that it's not just about history, it's about modern dentistry as well.
Correct.
And something we have tried to make it palatable to each and every individual of different age group and of different interests. If a artist is there, he will be able to see something which is
Artistic
art
point of view.
related.
if
Correct.
there is a person who likes sculptures, he will see sculptures related to dentistry. If it is about toys, there are some toys, also for the kids. And for every age group person, there will be something which will interest him or her.
Right. Wow, that's amazing. I mean, I think words will fall short if you want to describe not just the way the dental museum has shaped up, but the impact that it is creating. Thank you for sharing the journey of how the dental museum has come into the be. Doctor, my next question is to you, Dr. Pranav. How has the influence of having a father who is not just a normal dentist, but a dentist with such a vision, a forward thinker, a pioneer, a torch bearer, right? I think in your times, you would be somebody who's thinking 50 years ahead of what other doctors would be, has rubbed on to you. Was that the reason you became a dental surgeon to begin with? Tell me your journey.
Very honestly speaking, Dr. Vidhi, as a child, I used to be going to the dental clinic with mom. And in fact, my mom is a family physician. So I have seen both aspects of medicine, dentistry as well as general medicine. And I was lucky, there was never a pressure on me to become a dentist. My parents had me sit across the table when I was in grade 10, and they told me very clearly that, see, beta, it's not necessary that we are doctors, you need to be one as well. Uh, just be whatever you want to. Even if you want to pursue arts, do that, but become a good artist then. And obviously, as I was always being around with them since I lost my grandparents early, so I used to be with them in the clinics also. I was a little towards the mechanical mind types, and engineering also was something which I was looking at. But looking mom dad so closely and how they grew as professionals and how what kind of respect doctors as professionals would be getting, and dentistry is mechanics, biomechanics. So I thought I might as well join that profession, and subsequently I chose to become an orthodontist because I loved biomechanics, I loved wire bending. And yes, obviously I have been enjoying my subject very much. And everyone, like my colleagues, used to always say, oh, तुझे क्या problem है, तुझे तेरे तो पिताजी dentist है, you have a legacy already and you just have to go on and join him. But I would want to tell all our viewers through you and our scanO cafe that it is too much of a pressure when you have someone like dad in the family to live up to not only their expectations, and they didn't have some expectations of that kind, but to the patient's expectations, you know. And in Gujarati, they say that baap karta beto savayo. So you have to try and put yourself and make yourself at least 1.25 times better than what your parents and your family has already been doing. So it's a lot of a difficult thing. And I would say, even if I am able to not take it further, but maintain to the kind of level that my parents have and the kind of legacy that they are giving to me, I think my journey of life would have been more than fulfilled.
Purpose is met.
Yes, this museum thing has added a different dimension to our lives, and the best part, you know, Dr. Vidhi, about the museum thing is the smiles and the positive things that you hear from the museum visitors. And the majority of the museum visitors that we have are the school going children, and the kind of inquisitiveness they have, the kind of positive feedbacks that we receive from the teachers and the students. And we believe in catching everyone young. You know, dad has always advocated to one thing is, किसी को कुछ डेंटल प्रॉब्लम होने के बाद डेंटिस्ट के पास दौड़ के जाने के सिवा कोई ऑप्शन रहता नहीं है. But there are a lot of things which are on the preventive level, which are in the hands of the general population, which they can utilize and minimize dental problems.
See, we don't say that don't go to the dentist. You must see the dentist without problems also.
Regularly, correct.
On a regular basis, once every 6 months, you must visit the dentist. But if you do some preventive oral health care at home, you will have to not visit the dentist for problems, but for routine checkups and to learn and understand more how you will not land up in bigger problems.
Correct. Yes.
So my journey has been very interesting one, and sometimes I would say that it is challenging also, as I said, to meet up with the patient's expectations
Correct.
more than the family's
Yes.
expectations.
Yes. And to keep continuing the legacy. I would like to cite a very funny example that when Shah Rukh Khan's son was asked that would you like to be an actor, are you looking, he was like, no, meeting my father's legacy, and the responses, it's going to be a huge pressure, so I better be somebody on the back end. So he got into writing of the scripts and those direction,
Right.
and he was
Right.
like, I can't become an actor.
Absolutely.
Yes, I want to be in the
Absolutely.
same industry.
I definitely cannot think of completely getting into my father's shoes ever. It's an impossible role.
Mhm.
But yes, I am trying my every bit to at least take what he has and continue doing what service he is
Yes.
looking forward
Yes.
towards the society.
No, and I can't even imagine the kind of pride you must be holding, right?
Oh,
For the
absolutely.
initiation your parents have done. In
Absolutely.
fact, just being your partner, being a dentist from India, it gives us such an immense pride that India and my own home state, Gujarat,
Absolutely.
holds such kind of a unique museum which
Right.
attracts thousands and lakhs of visitors every year. And especially kids, as you rightly mentioned, catch them young. I remember all the initiatives that we were a part of when I was in school are still deep down here and in the minds. We
True.
would never forget that.
True.
Versus
True.
initiatives that we are as a part in as adults. So, going back to the museum story, I want to highlight one more thing that this museum holds two Guinness World Records, right? What are those, and how did that impact both as professionally, of course, but also personally to the Chandarana family?
See, basically, we have got two Guinness World Record. One is of largest collection, as Pranav had said it, that is about 2,371 toothbrushes, starting from bone toothbrush with animal hairs to most latest 30-second toothbrush. So we have all the varieties of toothbrushes. That is one. And second is the largest display of toothbrushes, which is of great help and importance for a visitors to come and see. Because you see so many varieties which you even when I was collecting, even I never imagined that there can be a toothbrush like a roller toothbrush with a solar toothbrush. There can be a magnetic toothbrush. So many varieties. So it fascinates everyone to see with inquisitiveness. And what we have tried in our museum is that at every place there is an indirect message about maintaining oral health through that. So what happens mostly if you see the dentist can be over for preventive oral health awareness just in 5 sentences. Eat good healthy fibrous food. Don't eat too much of chocolates and sweet in between meals. Brush your teeth twice a day. Don't eat any of tobacco products or tobacco related products or use it, and visit your dentist once in a 6 month. It is all done. Having said that, you have said everything about preventive oral health. But if you tell that to young children or anyone, it is not palatable so easily. So what I learned, as I said, even I and even Pranav also, when we became a hypnotherapist also, that the message to the subconscious should go in an indirect way also. So the whole museum concept is to convey the message about oral health awareness in an indirect form.
It's an immersive experience.
Exactly.
And I think more than conscious, it might be hitting the subconscious mind.
Subconscious mind.
So then they can
So
take
that
the
can
actions.
penetrate them better, and that's for a good message that they learn. And as you said, I really feel very lucky to have Pranav as a son who is not only fulfilling, but he is going beyond fulfillment of my own expectations and thinking. And we are lucky to have a daughter-in-law who is also a dentist. She is also equally involved in communicating with what museum we have auditorium where we teach them about preventive oral health awareness through PowerPoint. She also equally takes interest and does her job wonderfully. My wife, of course, it's being because of her all help that I could achieve to this or reach to this stage, without which that would not have been possible. So I'm lucky to have a family, and fortunately now his son, who is just about 11 and 12 years, gives me an assurance that I'll take care of your museum. So that, that gives me a more confidence of 3 generations of dentistry museum in our country.
Absolutely. And I must say, this is a very valuable thing that you just mentioned, Doctor. My father often keeps telling that with the first generation will build things, second will continue the legacy, but third generation breaks things usually, right? Third
Absolutely.
generation is the gone generation.
Absolutely.
But the way I think you've navigated and the culture in your family, where a 12-year-old is assuring that, Dada, I will become a dentist and I will take care of this. It feels like, okay, your life at an age at 71, right?
Absolutely.
There's no, it's just peace and only peace in there.
Absolutely. Fully satisfied with all my family,
Right.
family members, and they are carrying out everything very well. Rather, I would add that after Pranav recently in our museum, he has developed animatronics in dentistry, where the various items speaks, moves, and conveys a message. We have even first oral health dental orchestra played with different teeth structures playing various music and then a symphony of it. He has also developed the first world's interactive wall, where we have taken from basics of care of teeth from pregnancy to last replacement with recent advances of implants. All these things are kept on one big session where you just touch what you want to know about that part and you get a whole video about that part also. So we call it as an interactive wall. So whatever advanced knowledge also other than what is exhibited in museum, they can get it. And that all thanks to Pranav's and his ideas.
More than interactive, I can already imagine. And next time I'm going to be there to experience it firsthand. What I can imagine is more than interactive, it would be an immersive wall altogether.
Absolutely.
That's a mix of, as you said, animatronics. It's a AR and VR combined, right?
Yeah.
With the display of information that a person sees.
So basically, there have been scientific studies which say that if a message is just read or heard of, it does not have so much of an impact as much as a message which is visualized in different forms. So through our museum, we have also tried to take different aspects of technology to make it more of an immersive content which can directly touch the minds of children and adults alike, so that all said and done, सब देखने के बाद ओरल हेल्थ का मैसेज उनके दिमाग में चला जाता है. Yes. So that is the whole idea of our museum, which we are very happy to do also. And I think that's what we are all doing this for. And we are happy to do that.
I think when any visitor enters your museum, it's not just the whole golden past of how dentistry has evolved, but the present that we have and the future of dentistry, which is the immersive, the extended reality, a mix of AR, VR, and AI, which is seen in your museum. We've seen that around how many hundreds of schools kids are already scanned on air.
Yes.
Would you like to say something about how is the kids' reaction when they see their AI dental checkups? And I'm sure it's the first time for them, and first time when the parents gets that report on their WhatsApp. I would like you to cite, because as much as would love to see it firsthand, and I will when I come, You have seen so many students getting scanned. How is their responses and when their parents call back?
All thanks
So
to
that
AI.
is I think, as you very rightly said, AI scanO air has become a very interesting and talk of the museum thingy in our museum after its introduction, and thanks to Dr. Vidhi and team for collaborating with us for the same. See, basically, we after so many school visitors, and we happen to have our clinic on the ground floor, just beneath our museum. So the school teachers used to say that, doctor, you have your dental clinic. Why don't you do a dental checkup for our kids? Now, at a time, we get 100 kids in our dental museum. For us, three of us to do a dental checkup in our multi-chair setup also is going to be a task. So the moment we came across the scanO AI robot, we were pretty much excited that we will be able to give this facility to our museum visitors. It is interactive, interesting, and when the word AI is there, and when they get their oral health screening report in a split of a minute, is something very, very interesting, intriguing, and this present generation of kids enjoy using this kind of technology. And I think after the the introduction of the AI scan robot, all the kids, when they come to the museum visit and they have heard about it from their friends or other people, they'll say that, "वो AI scan कब करेंगे?" Right?
Correct.
And while they are undergoing that, also they are very happy to see their faces on the screen, their teeth on the screen.
That's
The
what
friends are talking about, "Hey, तेरे दांत में ये है वो है," and the report will tell you this is wrong and that is wrong. So it's a very, very interesting thing, and I think it's the right use of AI technology for sensitizing the people about the dental problems. See, sometimes what happens is a person may have a dental problem. He or she may be reluctant in sitting in the dental chair.
that's
But this scanO AI robot would be a device which is there, which is not a doctor looking at you, right? So they are just playing with the computer sort of, and the camera is taking pictures, and then they'll get to know, and then they'll realize the importance of the problem, and they will be motivated internally to seek dental advice. So it's I would say, all in all, a great addition to our museum for preventive oral health awareness.
Correct. In fact,
and,
I feel
and as you very rightly said it, these days of our mobile technology, everyone likes to have a selfie.
Selfie.
yes.
So they would like to see themselves on a screen and with a smile very well. So
Correct.
they are more than happy to get that done.
Correct. It's like a tooth selfie.
Absolutely.
Right. An
Absolutely.
extension of face selfie. And in fact, I mean, we are happy to be that AI partner, but we feel lucky that scanO Air is sitting in the Asia's first private dental museum.
Absolutely.
It's an honor for
Absolutely.
us. It's an honor for scanO Air, and it's definitely an honor for my entire team who's working day in and day out to keep adding more such interactive and immersive sessions for our
Right.
children and adults who are scanning. As you mentioned, doctor, it definitely helps in breaking that fear, right? Now, a child who used to think, okay, मेरे को dental chair पे नहीं बैठना, I'm shit scared. He is opening his mouth and everybody is discussing their oral health. I think that is just the beginning, and we are just touching the tip of the iceberg. What I want to understand, Dr. Pranav and Dr. Yogesh, is are you seeing a pattern of changing habits in children? That, okay, they had come on 1st of January, for example, and got a scan. Their oral health score was this, and their oral type was, say, a cavity oral prone or something else. After that immersive experience in the entire dental museum, do we have a record, if at all, that after they have scanned in 3 months or 6 months post their first visit, there, has there been any change in the trend or oral health score or their behavior? Can you throw some light on that?
I think we have not yet
Got into that aspect of screening,
following
though.
up.
Following
But
up screening.
yes, one feedback that we usually get from after museum visits, and say, for example, if the same teachers are getting other grade students from their school, is that subsequent to these museum visits, the conscious attempt amongst the children and the museum visitors definitely improves. And their concern about oral health increases. See, we fail to understand that, rather, the general public fails to understand that oral health is the gateway to the body. And आप बादाम खाओ, पिस्ता खाओ, काजू खाओ, बट दांत ही नहीं होंगे अच्छे खाने के लिए, तो द फर्स्ट स्टेप ऑफ digestion and nutrition starts from the oral cavity. Now, we are also trying to push in this thought in their mind. And after a museum visit, yes, as I said earlier in our personal talks, we do not utilize the museum in any way for any commercial benefit. Anywhere in the museum, you will not see that you come visit us. It's always visit your dentist. Even in our oral health report that is generated from the scanO EIR, it is visit your dentist. It's not visit us. So the whole idea is preventive oral health awareness, and I am sure it is adding a different dimension to oral health awareness, and patients who receive that report, they'll take it seriously up and go see their dentist. But overall, the feedback that we have received over these years is that patients are becoming more conscious about oral health, which is the right thing and which is the whole aim of our dental museum.
No, that's an absolute first step which was required in the history of Indian dentistry, where the prevalence rate is touching 75% and less than 9% visiting a dentist. So that gap, when we are making screening accessible, we are sure they will take their oral health seriously and get preventive treatments in time and have good set of habits, as you rightly mentioned, the 5 things. Maybe I would like to propose that all the schools that we've done first scan, let's start up with a follow-up scans. Now it could be either through air or through app, does not matter. But if we can measure, and I think that would be the right numbers and impact that we can measure.
Absolutely.
And keep screening those kids every 6 months while they upgrade from their standard 1 to 10th and even beyond. We will have the kind of data which I think nobody else.
Absolutely, it can be a matter of very good research, and as you very rightly said, data is something which is everyone is behind these days, you know, and this kind of data can definitely give a positive insights about the oral health trends of the Indian population as well.
Correct. Yes. In fact, as we speak, one of the professors in periodontics from University in Maharashtra, she is pursuing her PhD on the impact on the habit of kids post screened by AI versus traditional screening.
Oh, that's wonderful.
And she is doing this follow up of every 3 months among these kids.
Wow,
Did
that's
they
interesting.
start brushing twice? Are they starting to floss regularly when they achieve that age of flossing? Have they stopped eating chewing gums or chocolates between meals? And when we see that screening report, we exact have the oral health
Idea.
score number. Doctor, I'm enjoying the conversation, and I'm sure our viewers are also enjoying more than what I am. It's like a room filled of so much of motivation and inspiration that the young generation will be getting. And that comes to the last question that I have for you, Dr. Pranav. What message would you like to give to dental students, dental practitioners out there, of how can they also think differently? And is there something that you would like to press upon during this message?
Dr. Vidhi, I would only say one thing, and that is particularly for dental students and fresh dental graduates. Dentistry is an ocean. As much as you dive deep into it, you will only the ones who dive deep into the sea, they get those pearls, right? Something like that. The more you get into the subject depth, the more you will explore it, the more you will be able to utilize it in different forms. Dad always says that there is never a competition amongst colleagues. They are always complementing each other. And preventive oral health awareness is the primary key to anyone's successful practice. If the patient is aware of a problem, then he or she will undergo that dental treatment. And for that, you have to find out time to educate the patient. And the Council on Dental Health, which is the wing of Indian Dental Association, and our preventive and community dentistry specialty also focuses on this. But our internship time and our posting times, we don't spend time in doing all this. And then we say that patients don't turn up for their regular checkups. So I think for the dental students, I would say that work very diligently with your preventive oral health awareness programs. And for the general public, I would say it is very important for you to take care of your oral health, because it is no doubt the gateway to your general health. If your oral health is good, your general health is going to be absolutely perfect.
Correct.
That would be my message for the general public.
Wonderful. And I think during our next podcast or a session, when we have the data of follow-up things, we can actually put a number to how much percentage of your general health is being affected by your oral health. And later we can have a split of your heart health is affected, say 25%, your brain health is affected 35%. In pregnancy, we know about
Yes,
preterm delivery,
yes.
it is affecting 100%.
Yes,
So we can
absolutely.
actually put that numbers out post our research comes out.
Sure, sure.
That's a
sure.
wonderful message, doctor. It's an ocean. Nobody's competing. Everybody's complementing each other. So make sure you have that in your mind when you start your practice. Coming to you, Dr. Yogesh, if we have to know the mission of Dr. Chandarana Dental Museum in one sentence, what would that be?
The only sentence that I would like to say to everyone: learn, earn, and return. As a student, you learn the things. As a practitioner, start earning, and after you earn, the society which made you learn and earn, give back to society in the form of a return. So learn, earn, and return is the one sentence that I would like to tell everyone. Now, since you said that, I can add that we have so many things in our museum where even if some dental student wants to come and see
Research.
and do a research, he can do a very good research on the various issues. So we have collected all varieties in a way which we can document it, we can research it, and we can publish it.
Right. And as
Thank
we are
you.
sitting in this conference of innovation and research, I would like to make a personal plea that all the UG as well as PG students, please take your research seriously. The resources are unlimited, right? Doctors like them who are inviting you to come to their place, to their museum, and get a hint of what is that topic that you want to look at. There is so much more to be done, especially from our country. So I plead all of you to please visit, meet them in person, and I'm sure it will add a complete different dimension to their careers.
True.
Thank you, Dr.
Thank
Vidhi.
you so much for a wonderful
For
time.
inviting.
I still can't believe your age, doctor. We need to know what is the secret of your health, even at this age. I mean, we and Dr. Pranav have been moving a little bit. You've just been sitting at that position, and we could not even take a water break. Tell me your secret.
The only secret is one: God is great and kind to me to keep me fit. Number one. Number two, keep a very good motivation in life to motivate yourself for some goal in a life. Keep that goal very clear. And number three, my wife, who is a family physician, she is the whole secret of keeping me fit even at this age. She takes so much of care and gives me so much of love to me and my family members that we are all going to remain fit for sure.
Thank you so much. Thanks
Thank
for
you.
sharing.
Thank you
this
very much. Thank you for
Thank
having
you.
us over.
Thanks for all the invaluable
Thank you very
messages that you provided.
Thank you.
And I plead the visitors, if you loved this episode, please like, subscribe, and share. I'm sure after you watch this, there won't be a single person who's not sharing it.
Thank you. Thank you. Thank you.
Thank you.
What an incredible conversation. Dr. Yogesh and Dr. Pranav, your dedication to preserving dental history while innovating for future is truly inspiring. From setting world records to integrating AI and AR into dental education, you've not only built a museum but a movement that makes oral healthcare engaging and accessible to all. Your journey reminds us that dentistry is not just about treatment, it's about education, awareness, and community engagement. Thank you for sharing your insights and for making a lasting impact in the world of oral healthcare. To our listeners, if you ever find yourself in Vadodara, make sure to visit Dr. Chandarana's Dental Museum. It's a one of a kind experience that blends history, science, and technology in a way you've never seen before. Until next time, keep smiling, stay curious, and remember good oral health is the foundation of overall well being. See you in the next episode of scanO Cafe.